pseudoscientific claims in the wellness industry are everywhere, and it's kind of like playing the arcade game whack-a-mole, because one pops up and then another one sprouts up. It can be anything from energy healing treatments to homeopathy. Energy healing treatments will say that we all have energy fields and that a practitioner can manipulate and move them without even touching us, and that's going to somehow unblock our energy blockages and then therefore treat a health condition like cancer or depression. That's of course absurd.
Dr. Jonathan Stea is a clinical psychologist and adjunct professor at the University of Calgary, specializing in addiction and mental disorders. Dr. Stea co-edited Investigating Clinical Psychology and authored Mind the Science, which critiques the wellness industry and combats pseudoscientific mental health misinformation.
The problem is that in the wellness world, you may get a lot of people who don't have any credentials or qualifications, so they don't have a code of ethics or what we call a regulatory body to worry about. So they can say whatever they want, and they can give people that false hope. Be skeptical. Not cynical, but skeptical.
Now, we talk a lot on this channel about longevity. So with your expertise in mind of psychology, and I've heard that you do something called concurrent care, where you talk about addiction in addition to mental health. So I'd like to talk a little bit about the mental health aspect of longevity. I'm wondering what your take is and how you've seen a change recently, if you think it's more prevalent, less prevalent than ever before.
Yeah, my pleasure. My day job is working in a what we call a concurrent disorders clinic. So we treat people with severe addiction and concurrent mental disorders. And so I get to do things like one-on-one therapy and group therapy, and I work with other psychologists and social workers and psychiatrists and addiction medicine physicians. And so we're really just trying to help people who come to our clinic who present with those problems. The longevity stuff, it's something that I've seen kind of in the wellness world, right? So we see that, and I think it preys upon people's vulnerabilities, because what we often see in that space is that the longevity influencers will pitch aging or the aging process as some sort of disease that needs to be stifled or stopped. And the approach that longevity influencers will take is a pseudoscientific one, meaning they will pretend that they have the magical elixir or the cure or the one treatment, the revolutionary new treatment that will help, which is often some sort of supplement that they're selling or some sort of detox diet protocol that they're selling. And of course, we say that's pseudoscientific because there's at the end of the day, to be frank, there's no evidence behind any of that. I mean, what we know from the literature or the scientific literature is that just when people get back to the basics, or it's a foundational way to help with health generally, and including mental health. And so by basics, I mean just things like basic self-care behaviors. So eating well, eating nutritiously, getting adequate and restful sleep, exercising regularly, not smoking, which is, linked to health problems, reducing alcohol, connecting with community. Those are just very basic behaviors that don't need to be sold and packaged in sort of a wellness industry kind of way.
Right. Yeah. It kind of sounds like people are rebranding it, to make a profit.
That's exactly what's happening. That's what we see. And it's dangerous because I think it financially exploits people, and it emotionally exploits people as well, because the aging process is a part of life. I mean, we all go through transitions across the lifespan. And I think one thing that, maybe all of us are in some part wired to want to prevent that aging process, because, it comes with a kind of grief as we kind of move through certain stages of life. And certainly our culture places a lot of emphasis, and status on, beauty and looking young and things like that. And so those kinds of beliefs can be internalized in people. But I think ultimately when someone develops a preoccupation with preventing the aging process, that's not really a helpful thing in my view, because it sort of, it robs someone of the opportunity to cope with and embrace life's various transitions across the lifespan.
So why now, do you think? I mean, I feel like there are so many more influencers out there who are, seizing this kind of opportunity, but why now?
I don't know the answer. I think it's probably many variables that are involved. The biggest one, in my opinion, is I think with the rise of social media, we've just seen an explosion of misinformation generally, and just an explosion of wellness influencers generally. And I think longevity is one part of that.
And what do you think are the most intensive risks to people's mental health when they really attempt to lengthen their life and, buy into all these different claims and all these different products?
Yeah, well, like I said, I think it's it can be financially exploitive, and yeah, like it can take a toll on someone's mental health. It depends on, their repertoire of coping skills. But when someone becomes so preoccupied with trying to stifle that, a very normal process that will proceed anyway, they're fighting a losing battle, so to speak. And so the extent to which they're prone to things like depressive thoughts around that or anxiety thoughts around that, that's going to take a toll on people.
You said in an interview with Healthnews that these influencers often base their claims on anecdotal evidence. Why do you suppose they do that, and what should we take away from that?
Totally. Yeah. Anecdotal evidence is one of the pseudoscientific warning signs that I mentioned in my new book, Mind the Science, which tries to help people protect against mental health misinformation in pseudoscience. But really, the use of anecdotal evidence is the pseudoscientific warning sign just for in general. So we see that in the wellness space. And so by anecdotal evidence, we kind of mean things like testimonials. So if you go to someone's website, say a clinic website, they'll say that, my treatment protocol or my diet protocol works because Bob said it or Karen said it. And that's what we mean by anecdotal evidence. It's what we call an N of one. It's just one person saying that it works. And the reason that it's so appealing to us is because our brains are just kind of wired to believe that. It sort of preys upon, it's a fancy name of a fallacy. It's a Latin name. It's called the post hoc ergo propter hoc fallacy, which just means just because something happened before and then an event happened after, that there's somehow a causal explanation. And so, for example, just because someone takes a shower every morning and then the sun rises doesn't mean that taking a shower every morning causes the sun to rise.
Of course.
Similarly, someone will say, well, I drank some water, or I took this treatment and then I felt better afterwards. Therefore, it's the water or the treatment that made me feel better. So the causal influence isn't there. And pseudoscientific promoters or wellness grifters will use that because it's very compelling and intuitive, but it doesn't speak to the science. And so it's actually it's a hallmark of pseudoscience.
Are there any specific claims that you find particularly troubling?
Yeah, I mean, I don't even know. It's a great question, and it's hard to know where to start because the pseudoscientific claims in the wellness industry are everywhere. And it's kind of like playing the arcade game whack-a-mole because one pops up and then another one sprouts up. And so, it can be anything from, energy healing treatments to homeopathy treatments. And, these are specific things that people can Google, but they're basically scientifically absurd because when you look at the theory that underlies them, the way that they're supposed to work is really just divorced from all of the scientific literature that now exists. So for example, energy healing treatments will say that we all have human energy fields and that a practitioner can manipulate and move them without even touching us. And that's going to somehow unblock our energy blockages and then therefore treat a health condition like cancer or depression or post-traumatic stress disorder. And so that's of course absurd. But the reason that, since we know that pseudoscientific claims are like whack-a-mole, it's sometimes more fruitful or better not to really debunk the particular claims themselves, but to understand the underlying features of what makes something pseudoscientific, like those warning signs that we talked about, like anecdotal evidence would be one of them.
It probably gives them a sense of false hope, which probably really negatively affects their mental health.
Yeah, it gives them a sense of false hope. And it's sort of worse than that from the perspective of the clinicians, because for bona fide health professions like psychologists and social workers and physicians, we're not allowed to deceive people and say that a treatment works when it doesn't, because we have a code of ethics and a legal standard of standards of practice, which governs our license. We have a license to practice. So we can't do that. The problem is that in the wellness world, you may get a lot of people who don't have any credentials or qualifications, so they don't have a code of ethics or what we call a regulatory body to worry about. So they can say whatever they want, and they can give people that false hope. And again, in the world, the online world of Instagram influencers and TikTok influencers, that can be dangerous.
We're also kind of in an age of like no accountability, from people who put this out on the internet. They don't have paying customers per se. They might be getting ads. They can put this money out to people who take it, and it might not be real, but who's going to blame them and who's going to, tell them to stop?
Exactly. So like if something goes awry or wrong in the practice of bona fide health professions, like if your family doctor screws up or your psychologist screws up, psychologists and family doctors have a regulatory body. So they're called colleges, and this varies across different countries and jurisdictions, but basically there's a governing body that is designed to protect the public, and it's responsible for giving the licenses out. And so if something happens, someone can file complaints to those regulatory bodies, and those regulatory bodies can either sanction the person or help that person remedy the situation so that it doesn't happen again. In the wellness world, you don't have that regulatory body, so someone doesn't have a recourse when shit hits the fan, so to speak, other than that person trying to file a civil lawsuit of some sort. And who the hell wants to go through that? Because that's
right.
very stressful.
Who's got the resources to go through that either?
Exactly.
Are there any specific red flags that you can point to that people should really be mindful of when they see these claims on the internet? So
in my book, I list a number of what I call alternative medicine tropes. And so a trope is like a common or often repeated idea or theme. And so one of the important things to kind of know about alternative medicine is that it's not just a set of unsupported treatments or pseudoscientific treatments. So it's not just energy healing or homeopathy, but really it's an entire narrative. And this is kind of the argument that I make in the book, is that it's a narrative and it's an ideology, meaning there's a whole set of propaganda tactics and tropes or languaging that people can look for and try to spot. And the whole point of that narrative is to sow distrust in mainstream medicine, because the whole narrative is to say mainstream medicine doesn't work. They don't know what they're talking about. We have the true answers. And so one of the, for example, one trope is that if you Google, say, a local alternative medicine clinic for, say, depression or cancer or something, I almost guarantee you'll see something like, unlike mainstream medicine, they only mask the symptoms. Their treatments only mask the symptoms. Our treatments address the root cause. You'll see that trope repeated. And then when you dig deeper, though, you'll see that the root cause that they're purporting is often a false root cause or a pseudoscientific one. So, for example, it's a unblocked energy field that needs to be treated with energy healing, and then they, of course, will gift you that treatment by charging you to do that. And so it's a fake, it's a fake promise.
How do you think people get into alternative medicine? And I mean, both the people who take the money and the people who pay the money, right? Like, how does a Reiki healer, for instance, have they been misled, do you think, in some ways?
I think the vast majority of alternative medicine practitioners, are actually very kind and caring people. I think that they do, they want to make a living and they want to help people. I think that, that's the majority. I'm sure there's malicious kind of grifters out there too that just want to exploit people, but I find it more palatable to believe that the vast majority actually care. And I think that they are kind of married to some sort of pseudoscientific belief system, and they actually believe that it works. And they may, to be frank, have some kind of poor science literacy skills when it comes to understanding how to interpret and evaluate scientific evidence with respect to their treatments. So I think that's part of it. The other part that you're asking is, well, why do people turn to alternative medicine? And we know there's a lot of research on that, and we kind of know that. And I think what I really wanted to make clear in my book, and what we need to make clear here, is that it's not about blaming and shaming people for turning to it, because there's very good reasons that people do it. There's one of those reasons is that mainstream medicine fails a lot of people because, to be frank, our science by definition is evolving, and and growing, and we have gaps in our knowledge with respect to how mental health works, how mental disorders work. Our treatments aren't perfect, and even some of our best evidence-based treatments don't help everybody. And that's a really sad reality. As a clinical psychologist, I'm unable to help all of my patients, and so I totally empathize and I get it. And so people will turn to these other alternative practices, and who wouldn't, because desperation is intoxicating. And so we really get that. The problem is that just because we have gaps in our knowledge and gaps in our treatments and our healthcare systems, that doesn't mean that the solution is pseudoscientific grift in the alternative medicine industry. Because back to that narrative, those people in that narrative will say that they do have the answers. It's almost the opposite of being humble and the opposite of being nuanced. They'll say alternative medicine, those guys don't know what they're doing. They come to our diet detox protocols and my supplements and my energy healing, and we can treat you with a 99% success rate. That is exploitive, again, financially and emotionally.
Did you have like an aha moment ever in your career where you this was your opinion on alternative medicine? Like, did you see something in your practice, or was there ever a time in your life that's what kind of shaped your view on alternative medicine?
It's a good question. For me, it's sort of been an accumulative kind of process. But if I had to say kind of one event, I guess the onset of the pandemic, the COVID-19 pandemic, really just, the World Health Organization called it an infodemic, meaning there was just so much misinformation online that just kind of blew up. And I think that's what really opened my eyes and a lot of science communicators' eyes to the harms of what it can do, because what we saw that it, and in large part what it did, is really mobilized the anti-vaccine movement and the alternative medicine community to, which are actually kind of bedfellows, because if we're saying that, mainstream medicine doesn't know what it's doing, that vaccines don't work, that psychiatric medications don't work, well, that's one part of it. And then the other part is alternative medicine has the solutions, come buy our kind of products. And I think that when you have so much misinformation on a grand scale in such a public health emergency, that can do a lot of damage. And I think that really, in part, that's what opened my eyes to it.
So when I think of alternative medicine, I think of traditional Chinese medicine and Ayurveda. Do you think that they have any bearing in today's medical community? Since they've been around for centuries, for instance.
So Ayurveda, is a pre-scientific, kind of pseudo-scientific system of medicine. Even the National Center of Complementary and Integrative Health, which is a US-based organization on the government side devoted to researching this stuff, has said there's very little evidence to support its use for the vast majority of health claims. Ayurveda kind of combines lifestyle interventions, which are good, but also kind of with herbal products, which again don't have a lot of evidentiary backing, and some of them can actually be contaminated and cause a lot of problems. And there's a great there's a champion of public health named his name is Syriac Abbey Phillips, and he's in India, and he's been a champion fighting back against Ayurveda and the kind of the government system, because Ayurveda is so intertwined with the Indian government that he's actually had a lot of pushback on this. So he's I spoke with him and interviewed him in my book, and he was kind of saying how harmful it is. He's a medical doctor. He's seen a lot of liver injuries come from it, and even problems associated with it being able to treat mental illness and mental disorders. Similarly with traditional Chinese medicine, not a lot of people know this, but traditional Chinese medicine, you mentioned it's centuries old, but it's actually not as a package, because there's a guy named Alan Levinitz, and he wrote in Slate, which I encourage people to Google, but essentially traditional Chinese medicine it was invented by Chairman Mao in the 1950s.
Really?
Yeah, in communist China, to kind of push a lot of propaganda. The reality is that there's traditional Chinese medicines, not the whole system of traditional medicine, which is sort of a propaganda tactic. And so, there's various medicines like herbal products or acupuncture, things like that. And again, when you dig deeper into this stuff, you really do see that a lot of the claims are divorced from a lot of modern scientific knowledge.
When I think also of alternative medicine, I also think of Gwyneth Paltrow. And I think of King Charles too. He's got this cancer health issue that he's dealing with. Why do you think that these celebrities, I guess they're kind of influencers, but mostly celebrities, use their platform to talk about alternative medicine?
I think there's many drivers of that. I think financial gain is one of them. Gwyneth Paltrow has a $250 million natural lifestyle company called Goop, and she sells a lot of this stuff. You could find a $135 Implantorama product, which is basically a coffee enema, which means kind of shooting coffee up someone's bum to treat depression. And there's no evidence that this stuff works. Yeah, this is people.
I wouldn't want to even take that risk. I don't think
it's hilariously absurd, and we can laugh at this stuff because it's funny. It's truly funny, and at the same time, it's also incredibly harmful because people actually buy into this stuff. Imagine someone who is suffering from depression, and they're believing a celebrity that this product can help them, and the scientific reality is that there is no body of scientific research or theory that says that coffee enemas can treat any health condition, let alone depression. And in fact, they can be quite dangerous and result in burns and kind of bacteria getting into the bloodstream and inflammation. So, that's a harmful thing. I think that, financial gain is only one thing, though. I think that pernicious or pervasive would just be that kind of ideological belief. I think people actually believe this stuff works. Again, for better or worse, they're married to pseudoscientific beliefs, or they have poor science literacy skills. King Charles, he's been a huge advocate for decades for the practice of homeopathy, which we briefly talked about. And for people who don't know what homeopathy is, it's absurd in and of itself. It basically postulates that an active ingredient in a remedy is more effective when the active ingredient is diluted out of existence, meaning it's just basically water or a sugar pill or alcohol. And instead, according to homeopathy, water, this is called homeopathic water memory, is that water has a memory of the molecules that were kind of diluted out. That's literally its theory, and not a lot of people understand what the hell homeopathy is, but that's what it is.
Besides the coffee enema, for instance, or do you have any other examples of specific treatments that have negatively affected someone's health because they've bought into this alternative medicine?
Well, I think when we speak about the harm of kind of pseudoscience, I think it's helpful to frame it in a number of different ways. There's at least three levels. So one is direct harm. So the treatments themselves can cause harm.
Right.
There's lots of different cases like this. One famous example is the case of Candace Newmaker. It was really unfortunate. She was a 10-year-old girl, and she was reportedly diagnosed with something called a reactive attachment disorder. So she was basically not attaching to her caregivers. And so the belief from her mother and the social workers working with her was that she needed to undergo a treatment called a rebirthing therapy, which is the idea that someone's trauma, or the reason she wasn't connecting with her caregivers, was because she experienced trauma during birth. And so the treatment of rebirthing therapy is to rebirth the person, to relive the experience of birth. So what they ended up doing is actually smothering her with pillows and this kind of blue flannel sheet, and she ended up dying of asphyxiation. It was terrible. So, there was a law enacted in Colorado called Cannabis law, which kind of prevents active restraint used in psychotherapy and treatment. So, that's just one of them. And so this is one example. Granted, not all cases result in death. Most often, and they can cause, pseudoscientific treatments can cause a worsening of mental health symptoms directly. There's a number of examples of those. The other layer to the harm of pseudoscience is that it happens at an indirect level. So when people are kind of going to the wellness scripters and getting their treatments, they're wasting their time and their money. They could have been accessing evidence-based treatments that could actually help them. And so while they're accessing these fake treatments, their mental health symptoms could be getting worse.
What specific advice would you give to people who are considering using alternative medicine? What alternative to the alternative medicine would you suggest?
I think one thing I wanted to do in my book is I just really want people to be skeptical. Like use your spidey senses, so to speak. And what I wanted to do in the book was to teach people the language of alternative medicine, to teach them the pseudoscientific warning signs. I'd like people to memorize them, so to speak, because once people learn this language, they can see the pseudoscientific warning signs. I think then people are less likely to be deceived and duped by these treatments. And so, again, we can't blame people for seeking alternatives because, again, desperation is intoxicating. At the same time, people don't deserve to be exploited.
I feel like people, especially when it comes to their health, they'll be willing to do just about anything,
Yeah. And the problem is that with alternative medicine treatments, the reason science is so important is that science is there to evaluate the safety and the effectiveness of things. And when you get alternative medicine treatments, that don't work, we also know that they can be harmful. And so people may seek any kind of alternative medicine treatment. It might not work, which is okay, but it could actually be harmful too. That's why people need to be very wary.
If we can turn briefly to cannabis use, I was wondering what you thought about people like Joe Rogan, Dr. Oz, who talk about cannabis use for improving mental health.
Well, it was the topic of my doctoral dissertation, so I've done a deep dive in this stuff for years, so I kind of know the cannabis literature. The reality is that I think it's helpful for people to understand that cannabis isn't just one thing. It's sort of, I know we call it cannabis like it's one plant, but it's sort of many things. And the reason for that is that it has almost 600 or more different, what we call cannabinoids in it. So different kinds of chemicals, and all of those have different combinations and permutations. And so the most famous ones are tetrahydrocannabinol, THC, and the other one is cannabidiol, which is CBD. Those are the two most kind of famous ones, and they work in very different ways. So depending on dosages, THC, we know, can kind of produce euphoria, but it can also be anxiety-inducing and psychotic-inducing, cause kind of psychotic symptoms in some people, whereas CBD can be what we call anxiolytic or anxiety-reducing and have antipsychotic effects as well. So number one, those two kind of chemicals work in different ways. And then when you look at kind of the scientific literature more broadly, it really does show that the bulk of evidence, there's a lot of mixed findings with cannabis with respect to treating mental health, and it's sort of tilted towards the idea that it actually makes mental health symptoms worse for, say, example, depression and anxiety. And in part, I think a lot of the reason for that is that it really it can rob people of the opportunity to practice healthy adaptive coping skills when they're encountering uncomfortable emotions, just like any kind of acutely active substance like alcohol. If someone's angry and they're sad and they're anxious, instead of practicing a healthy coping skill to deal with that, they turn to a substance that can immediately numb or turn those experiences off or change that emotion. If people do that, say 100 times over and over and over, that's in part how an addiction can kind of develop.
Lots of people have said that cannabis is a gateway drug, marijuana is a gateway drug. Yay or nay, do you think then?
Strangely, nay. It's, I know that was sort of a propaganda piece kind of put out back in the day that cannabis is a gateway drug, and by that meaning that, someone will start to use cannabis and then right away they're going to ravishly want to go do heroin and cocaine and sort of quote unquote other harder drugs. The reality is that, kind of back to this idea of correlation and causation, people who, if at a population level, marijuana or cannabis use tends to be correlated with other drug use. That doesn't mean that marijuana use or cannabis use causes other drug use. It could just be due to other underlying factors that, people are using it to just change their experiences. And I also want to emphasize that the vast majority of people that use cannabis and alcohol don't develop an addiction to it either. That's, it's a minority, but it's a substantial minority because so much of it available and accessible. And those are the people that happen to come to clinics for addiction and the people that I see.
What do you think should be a priority in terms of research with cannabis? I mean, do you think that they should talk about its role in mental health? Do you think that there should be more research into the cannabis use in the cannabis industry?
Absolutely. I think cannabis is a fascinating substance. We have an endocannabinoid system that it binds to. And so I think it does have a lot of potential. It has benefits too. Like there's better research for it in that it can help with certain kinds of pain. It can help with chemotherapy-induced side effects like nausea. I'm just more skeptical with respect to its being able to help with mental health, given my decade of experience treating people with addiction and mental health concerns. But that's not to say that that can be ruled out, because at the end of the day, scientific evidence trumps my clinical experience. So I do think that if we have better science around it, then we would love to incorporate it into evidence-based practice and to use it for, say, depression or anxiety or any other health condition. But we need to see the evidence and good quality evidence, and then we would welcome it with open arms. You
mentioned the kind of the therapeutic effects of cannabis. How do you think patients can tell the difference between short-term relief of, nausea, helping with nausea, and then actual treatment? Yeah, well, I think it's harder even like with mental health, because people will get confused by that, because we'll often hear people say, well, cannabis helps my depression or it helps my anxiety. But really, it just like alcohol, if, someone's going through a breakup or, they're going through an emotionally tumultuous time, they'll use it and it'll take away their uncomfortable feelings. And that's not treating a depressive disorder. That's not treating an anxiety disorder, say. And I think just awareness of the difference can be in part a first step. And then I think, just if people are experiencing depression or anxiety, obviously talking to a mental health professional to kind of get an assessment of those problems is helpful in kind of differentiating the two points that you're asking about. Do you think that recreational use and actual medical use of cannabis are becoming blurred a little bit? Yeah, I think so. Because they're not completely distinct categories. Again, just like alcohol, like when you have kind of legal substances, which, I'm not against. I think that people are free to choose recreational drugs and kind of use them, but we want people to be thoughtful and honest with themselves and just to completely understand the risks and benefits of doing so. When people do that, then, that's fine, because like I said, the vast majority of people, we know this from large-scale surveys, don't end up developing a problem with it or an addiction to, say, cannabis. And again, even alcohol, people can use it responsibly. It's just that there's a substantial minority of people who don't. Well, those people deserve help, and they deserve kind of knowledge about when to get help with that. Some of the warning signs might be things like, if it starts to be all consuming, if it starts to interfere with your responsibilities, so like you're not going to work, it's interfering with your relationships, if it's causing you more distress than it's actually enhancing, those are kinds of signs that maybe, it's not recreational now, maybe you kind of need some help with it. I'm really interested in the fact that you helping people with addictions and then mental health. Do you think they exist alone, or do you think that they are really intermingled? They're very intermingled. The fancy term is comorbidity. We know that mental disorders and addiction are highly comorbid, which means they kind of co-occur together. But a lot of what we do in assessment, say, when someone comes to a clinic and they need help, is we try to tease out, is one primary, is one secondary, is one causing the other. So for example, a lot of substances can actually induce mental disorders. So, if someone is drinking, alcohol, say, daily for a long time, and then they come and they're feeling depressed, we may diagnose something like an alcohol-induced depressive disorder, but we really won't know whether it's an alcohol-induced depressive disorder until that person becomes abstinent from alcohol, and sometimes you'll see that the depression clears, and that's really great. For other people, they'll stop using alcohol and the depression remains, and then we need to treat the depression. So it's a very complicated picture, and that's in part what we're trying to do in psychological assessment, is tease those things out. Would you say it's kind of a growing field? Are people getting more recognizing how related they are? Yeah. I mean, people are devoting decades and careers to trying to better understand the nature of addiction, the nature of mental disorders. I think we've come a long way in doing so by recognizing that there's a lot of biological contributors, there's psychological factors, there's social factors. We call that a biopsychosocial model. So all of these things kind of come together. But obviously, like I mentioned before, we have tremendous gaps in our knowledge. We don't fully understand addiction. We don't fully understand mental disorders and how to treat them. And so we desperately need more research, and we need the field to advance in its science
to get better at understanding it and understanding how to treat people with it.
I want to talk a little bit about health misinformation now. It seems like every other week we have a different virus, like now it's M virus, or, it's just something new. How significant of an impact do you think that health misinformation online leads to public health outcomes?
Huge. We know that that's an empirical question, and we have answers to that in the literature. We know that misinformation does tremendous harm. It can kill. The reason for that is because it can be so widespread and it can influence people's health decisions. I think one of the biggest ways that we're seeing that right now is the anti-vaccine movement has really picked up a lot of energy, and a lot of clout with, I won't name names, but there's a lot of political leaders that are kind of bringing it to the forefront of our culture, and that is directly translated to people being, there's increased vaccine hesitancy. They're less likely to get vaccinated for a variety of things. People are less likely to use masks. We saw that during the COVID-19 pandemic. People are there's research showing that people are less likely to vaccinate their dogs right now. And so that's much, and it's not even about, I really like to emphasize that I don't want to blame or shame people for seeking alternatives and stuff. My beef, so to speak, is with the people that are exploiting those people and profiting from it. And I don't think that's right. And even pets deserve love too, and pets don't deserve to be exploited.
Of course. Specifically about COVID-19, what do you think would have been different if there had been less health misinformation online?
I don't even know that it could have been different. I mean, I'm going to be kind of pessimistic in that respect, because I think what it did was that it opened a lot of people's eyes to the nature of the scientific process, because, before people really thought science is kind of happening behind the scenes. And now we're watching it at the forefront. We're like, is there going to be a vaccine developed? And how does that happen? And how many trials does it need to, be effective? And so I think what that did for a lot of people is, for some people, it sort of strengthened their resolve and faith in the scientific process, because they saw how it's a very iterative process. It's evolving and it can change, and that will affect policy. And for others, I think, unfortunately, it really sowed distrust in the process. And I think worse than that is that I think what happened during the pandemic is that science became very, very politicized, and it became an ideological flag. And that's a huge problem, so that people don't really care about the science per se. They care more about their ideological flag. So it's Democrats versus Republicans, or it's liberals versus conservatives. It's like different sports teams, and that's going to activate a tribalistic part of our brain. And I think that's what also contributes to people falling for misinformation, because if the other guys are saying it, well, then it can't be true.
Yeah, right. What do you think is the biggest source of misinformation online?
That's a great question. I think, again, that's sort of multi-causal. I think one factor that contributes to it is just the nature of social media algorithms themselves, meaning, we're fed content based on what goes viral. And what goes viral are things like emotion-laden content, oversimplified headlines, oversimplified ideas, kind of the opposite of what we see in science, which is very nuanced, tentative language, deciphering the gray zones. Social media is not that. It's like black and white thinking, emotion, and I think that's a big contributor of misinformation. The other thing is everyone is targeted for misinformation by what I would call bad actors. So those are people just like Instagram influencers with huge platforms, guys like Andrew Tate, who are saying depression isn't real, and he's tweeting that to hundreds and millions of followers. Or Elon Musk is saying, SSRIs, which are antidepressants, are more harmful than helpful. He's tweeting that to millions, hundreds of millions of people. So there's those bad actors, and then there's actual organizations that are targeting people, like Robert F. Kennedy Jr.'s Children's Health Defense, which is an anti-vaccine propaganda vehicle, and it's well funded, and so people are getting fed that kind of content. And so, we live in a time where we have so much information at our fingertips, and it's hard to figure out what's legit and what's not.
So how do we know who to trust?
That's the $1 million question, and it's very, very hard. And I would encourage people, and I don't have the solutions at the at the systemic level. But one thing I do in my book is to try to help people, again, improve their science literacy skills, improve their health literacy skills, learn the language of alternative medicine and pseudoscience, because when you learn that language, it'll help people understand who to trust and who not to, because if they can see that someone's speaking pseudoscience, so to speak, that person can't be trusted, and you probably wanted to go to more credible sources.
What do you think has been the most outlandish claim that you've heard of health misinformation?
Every day I'm seeing I'm seeing a new one, so it's hard to pick just one. I mean, there's so many. This probably isn't the most outlandish, but it's up there. So I mentioned the nature of energy healing, which says that we have energy fields and they can be manipulated and balanced, or manipulated by a practitioner to treat our health condition. There's also something called distance energy healing, which means someone can do it from a distance through their computer, say. So I could be a practitioner and I could be manipulating your energy healing or your energy field right now via the computer. And even worse than that, it can happen across time and space, because I've seen people say, I will manipulate you on your energy fields on Monday. And you don't even need to attend the Zoom session to have that happen, and then I'll send you an invoice.
Wow. Have you encountered any patients whose mental health have been significantly impacted by misinformation?
I have, yeah, tons. And in part, that's what sparked that was the impetus for me writing my book. I really saw so many patients hurt by it, and that's what makes me want to help people to take their mental health into their own hands, to empower them with this kind of information to help navigate the wellness world, so to speak. So just as one quick example, I talk about this in the book as well. There's an anti-psychiatry movement, which is very much against the discipline of psychiatry. And in that world, you will also see a lot of recurring tropes or themes or ideas, one of which is the idea that mental illness doesn't exist at all. And again, that psychiatric medications are more harmful than helpful. Again, and I mentioned that we've seen those tropes parroted by influencers like Andrew Tate and Elon Musk. And I think when people hear a lot of misinformation repeatedly over time, that capitalizes on a psychological bias that we're all susceptible to, called the illusory truth effect, which just means our brains aren't good at differentiating familiarity with the truth. So the more time that we hear something, the more likely we are to believe it. And so people hear over and over and over that psychiatric medications are harmful or that mental illness doesn't exist. People will start to believe that. I've seen patients come to our clinic with those beliefs, and that can harm their treatment plans and their mental health.
It seems like you have a lot more work to do. I mean, it just seems so much harder in this, age of misinformation, as you have to treat the patient, but you also have to educate them to some degree, because these ideas are so ingrained and people are so manipulated by these ideas.
That's exactly right. And it's hard to, it's not necessarily my role to educate per se in the context of a therapeutic relationship when I'm treating people at a clinic. That's why I try to take to social media and to science communication and to writing my book, because it was a way I can try to help educate people in a different way that I'm helping people kind of in the clinic, because it's hard to do that when you're kind of one-on-one with someone and you're managing their mental health concerns. Just it's a different role.
What future trends do you see happening to battle misinformation online?
So I don't think pseudoscience and misinformation are going anywhere, unfortunately, and in part that's because of the reasons we talked about. There's a lot of financial factors and psychological factors and social factors at work in its service. So there's reasons that it's here to stay. And so that's a concerning trend. And especially with the increasing polarization and divisiveness that we've seen in the world. But a positive trend that I'm hoping for is that we do get sort of an army of science communicators, so to speak, to kind of go to the trenches where this misinformation lives, to help kind of drown out a lot of that noise, because there's so much information and it's hard to tell what's credible and what's not. So I'm hoping that it almost becomes its own subdiscipline or field where you can kind of train people to go and to translate science in palatable, accessible ways to the general public so that they can better navigate that terrain.
If you could give one piece of advice to people watching about alternative medicine and about misinformation, what would you give them?
Be skeptical. Not cynical, but skeptical.
Well, thank you so much for joining us today. It's been great talking with you.
My absolute pleasure. Thank you so much for having me.